Hello, I'm Dr. Christopher Saigal, urologist and urologic cancer specialist at UCLA Health. Today, I want to talk to you about how to make the best treatment decision when you're diagnosed with prostate cancer. At UCLA Health, we practice shared decision-making. Instead of your doctor simply telling you what to do, we work together. There is no one-size-fits-all answer. The best treatment depends on several personal factors: the severity of your cancer, your age, and your general health. You bring your values and goals, and we bring medical expertise. Together, we find a treatment plan that fits not just your diagnosis, but also your life. We have several treatment options for localized prostate cancer: robotic surgery, where we remove the prostate, radiation therapy done externally or with internal seeds, and active surveillance, where we closely monitor the cancer without treating it right away. Each option comes with trade-offs. Surgery may have a higher chance of curing the cancer, but carries the risk of urinary leakage or erection problems. Radiation can have fewer immediate side effects, but a slightly higher risk of recurrence. Active surveillance avoids side effects for now, but carries a chance that the cancer could spread. We've learned that patients misunderstand the risks and benefits or focus too much on one aspect, like survival. They don't realize how treatments may impact their quality of life. That's why decision aids, like visual tools or software programs, are so helpful. They present the options clearly and help you weigh what's most important to you. Maybe it's avoiding side effects. Maybe it's peace of mind. Maybe it's living as long as possible. There is no wrong answer. When your doctor understands what's important to you, they can advise you on how to best meet those goals. Let's partner on making the decision that's right for you.